Can't believe we've been talking about it for weeks, but Medicare open enrollment ends next week. So if you need to choose a Medicare Advantage plan, or if you have a parent who needs to choose a plan and they need some help, you still have some time left.
So how do you know which plan is the right one? Well, Marla Pantano is the president of Care Partners of Connecticut, and she is here to help. It's getting to be crunch time. Welcome.
Thank you for having me again.
Oh, it's our pleasure. We always learn so much about these different segments. You know, what are the different types of Medicare Advantage plans? Can we start there?
Sure. There's two major different types of plan. There's an HMO plans and PPO plans. And, you know, the HMO is a plan where you stay mostly within the network of providers that are offered, and you have a primary care physician. And the PPO plans allow you more flexibility to go out of network as well.
Now, are HMO and PPO plans, is one more expensive than the other? It sounds like the PPO would be a little bit more expensive because you get a little bit more of a choice. Is that not right?
So the actual premiums that you pay can be very similar. So we have $0 premium plans for both HMO and PPO.
Oh, great.
Often the differences are in the cost share that you pay to go see the doctors. And particularly when you go out of network, you tend to pay a deductible and some additional cost there.
Okay.
Yeah, so maybe just run down the differences so people can decide. I don't know which one is better, but between the HMO and the PPO.
Sure. So again, on the HMO side, as I was just describing, there tends to be, less amount of out of pocket, in generally speaking, that you have to pay for your services. But you do stay within, usually within the network of providers, although you can get referrals from your primary care physician to go out of network. You do work very closely with your primary care physician. So you are required to choose a primary care physician who helps really guide you through the system and gives you that resource to help you get to your best health. On a PPO plan, you can still have a primary care physician, but it's not required. And you also have that, you're really directing more of your own care often, and with that choice to go out of network. So it's really up to you. Again, if you know that you really work closely with your doctor and they help you guide your how you're going to get your care, then probably an HMO would be a better fit. But if you really want that flexibility and don't have as close alignment with your primary care, you may want to consider a PPO plan.
You've been doing this for years. Is there one that's a little bit more popular than the other?
In Medicare Advantage, traditionally, the HMO plans actually were the most popular. More recently, there has been an introduction of more PPO-based plans in the market, and it has attracted that maybe traditionally would have gone for a Medicare Supplement plan that we've talked about before that is much more expensive. Now with this PPO and allowing you on network, more of those folks that were uncomfortable with choosing the HMO have been willing to join the PPO. So those have been gaining in popularity.
Okay.
Yeah, so that was a great explanation of how both of the plans work for everyone. Is there some general advice for the people of, if you're this type of person, it's generally going to work better for you to do one or the other?
What I would suggest is that you speak to a licensed broker, an agent. You can do that by either calling us at carepartnersct.com, going online and finding a phone number and calling one of ours, or you can find an independent broker in your community, and they can really help guide you. I would suggest that you really look for an expert that can kind of walk through with you what are your needs, who are your doctors, what are you trying to achieve, and they can help guide you into what's the best plan for you.
Again, Marla, before we go, can you just talk a little bit more about the cost? I know we highlighted it, but I just want to drive it home. Is one plan a little bit more costly than the other? I guess it all depends on the PPO if you go out of network.
Yeah, it really depends on how you're going to use the plan and which one is the most advantageous to you. There are plans in the market, like I said, both for HMO and PPO that offer that $0 premium, but then you have to look at what does it cost each time I go to the doctor or go into a hospital. So look at those plans side by side. And generally speaking, HMO plans do generally speaking become more affordable when you look at it from that perspective. But again, each individual should take a look and discuss it with a trusted advisor to make sure they make the right decision for them.
And on December 7th, the deadline, right?
That's right. So it's just a few days away. It's next Tuesday. So you have just this last weekend to kind of get those decisions made. Medicare does offer an opportunity in February if for some reason you choose a plan and you realize it isn't a fit, that you can make another change at that point in time. But generally speaking, you want to try to make the best choice right now through December 7th.
And again, if you don't choose a plan on December 7th, you just get what you had, right?
Yeah.
Yes, for the most part, you roll into, continue to keep the plan that you had the prior year.
Okay.
So I know you've got some options. People can contact your brokers. You've got a free online meeting that people can go to really make sure that they get the right information. That's today or Tuesday at 5 p.m. or tomorrow at 9 a.m. We recommend that people do that so they can really make sure they're picking the right plan.
Absolutely. To reserve your spot, visit carepartnersct.com/connect. Thank you, Marla. We appreciate your time.
Thank you. Have a wonderful day.
Yeah, and a good holiday, too.